we are going to talk about health services in Tororo. Of course, I'll start by asking
what's the condition?
The women. What is happening at Tororo Hospital? Are you getting the services? Are they poor? Are they good? Yes. What are some of the services that you have received at Tororo Hospital?
Kala abamu engeri gy'okujjanjabamu buli omu kala alina mutima gugwe ndowooza enjigiriza oba ntono nnyo buli omu abeera n'omwoyo gugwe oyinza okugenda omusawo oba n'akuyisa for example yuzi nalinako omulwadde awo naye kati omulwadde nga ye talina maanyi kati bwe yali atambula neyeekona kuki ku musawo n'agaana okujjanjaba ki omulwadde wange kale kwegamba kyetagisiddwa eggwanga likole ki lyongeremuko amaanyi tubere nga tufuna obujjanjabi obukola ki obumalamu.
Are you happy with the services?
Of course not. The way the services are provided is not really appealing. I don't know whether the doctors are few in Tororo Hospital, because most especially when it comes to antenatal services. The other year, there is a mother who is a family friend and was pregnant, and she had been consulting her doctor on and off like that because she suspected she would get complications because her age was the age they talk of, you cannot give birth at that age. So she tells the doctor, in case of anything, please help me. And this woman gets a problem in the night and comes to hospital. She talks to the doctor and doctor says, I'm not on duty. She tries to talk to another doctor, the doctor says, I'm not the one who is supposed to work on you. Let us call another doctor, until the woman lost the baby. And I was talking to some of my friends who are members of parliament, because one time they came here and they were trying to find out the same things. And I was telling them, try to find out what the real issues are. And the issues were, we do not have medicine. We don't have drugs. And government says they send drugs every other time.
Yes.
Where do the drugs go?
Right. Thank you so much for sharing. Women, I think women visit the hospital a lot. Quickly. Yes. What's the state at Tororo Hospital?
I remember last year I had a cousin who was actually expecting. So when we got there, she was supposed to be operated. And then when we got there, the doctors were not there. They tried to call one whom they told us was on duty. And when we called him, he was like, this is past my working hours. I think you can wait for me. I'll be there tomorrow in the morning. Now, someone is bad love and you're telling the person to wait for you until morning. I don't really think that can work.
Wouldn't you say that these are just individual cases on a whole at the hospital?
Definitely, those are individual cases according to me. Because all I need to know that we must appreciate the efforts of government to put some of the facilities in place. But what I know is the problem in Tororo Hospital in particular is that Tororo Hospital is understaffed. One hospital serving over 8-10 districts, that means the number are really overwhelming. And because of that, the few doctors, the few nurses in the hospital also are human beings. They get tired. Well, we need to do a lot is one, to recruit the doctors, actually the medical personnel in the hospital. The staffing should be a little high.
Are these things very common? You know, we've had the father, you know.
Are they just personal experiences?
Yes.
Or?
Actually, my personal experience have been referring, escorting women and children to the hospital.
Yes.
But it's a very big challenge. You can go in the morning and then you come back in the evening without getting children in town.
Right.
And then there is a challenge on emergency cases. Like yesterday in the morning, I took children who are convulsing, but no one attended to them. I got a doctor. He tried to describe and refer to me in admission room. Reaching there, all the nurses were busy. They said, you people, you just go back.
Yeah, I want to thank very much the ladies who have raised this issue. And you know, most of us in Tororo have just said never to go to that government hospital. We go to clinics for treatment because that you are sure and you know you're going to get the medicine you want. But their contributions raises two questions. Questions of manners and questions of supervision. You know, if you are a government official, whether or not you are understaffed, good customer care, good handling of patients is something that will have to happen.
Paramount.
Yeah. Then the second thing is the issue of supervision. It's very common for government offices for people to arrive at the time they want and leave the time they want. We have been interacting with many duty bearers. You realize that people leave office at around 11 to go and begin planning for cock. They come back at around 2. So there's a very big gap when someone is not in the office. Now, I think much as there is supervision within the government, but as also the ordinary people, we must become a bit very vigilant and a bit militant. We must demand for accountability from people.
That's true.
Right.
So I think that the important thing is that the hospital needs to be responsive. The hospital needs to understand its society more and find creative ways to deal with it.
Right.
And yeah, I think that's
Right.
that's it. Really.
Well, the hospital, what has it that it was built in the 1930s, and it first served as a stopover for World War bound military fighters en route to the Middle East, and it was built with 100 bed capacity, but now has 200. We've got an opportunity to speak to the medical superintendent, Dr. Thomas Ochar, and when we come back, we'll look at how we can solve these problems, but ultimately overhaul the health system of this country. Take a look at this.
We have a high disease burden in the communities, and it is reflected in our OPD attendance. In under 5, outpatient attendance 16.1% is due to malaria. The next is malnutrition, also a common condition, followed by pneumonias and anemia, constituting the majority in under 5. Whereas in adults, malaria is still the leading cause of morbidity and mortality. Then tuberculosis is also a very big problem which we are facing currently, and this is related to HIV/AIDS. A number of challenges exist in the treatment of TB and HIV/AIDS because it is a long-term treatment, and these are drugs with a lot of side effects, and adherence is a challenge for us. So community participation becomes key in managing these people. The hospital depends on government funding majorly, and it is limited and sometimes it's not timely. So this creates a little bit of a hiccup in service delivery, coupled with limited number of staff and staff ceiling. The hospital per night has about 200 patients, but on paper, under Ministry of Health, the hospital is known as a 100-bed hospital. So when you look at the output, it is twice what it's supposed to do. We recently had challenges with sewage system, and the district identified some money to the tune of 46 million to repair partially the sewage system. But the long-term intervention would require Tororo Hospital joining the national water and sewage line, which would deliver all the sewage to the treatment plant. The problem comes in that the sewage line of Tororo Hospital was constructed in the 1940s, and some of the pipes are old. The diameter of the pipe is now narrow for the increased demand. By then, probably they were having about 50 inpatients a day, but now we're having over 200 plus outpatients and all that.
Quickly, you know what? We actually depend on government.
Ekintu kyetuliko ekyaddwaliro ly'e Tororo nze kinkwatirako ddala nnyo olw'ensonga waliwo olunaku lumu lwe twagendayo ekiro nga twagala okutuyamba nga badokita batugaa nti badokita tebakolaki tebasula wano ne twebuuza lwaki badokita tebasula wano ng'ate bannansi basula wano lwaki twagenda okutuukayo ekiro nga abannansi bakozesa bukando ne batutegeeza nti amasannyalaze bakoze ki bagasazeeko ne tugaa ddala gavumenti namba oba eddwaliro eddamba ekkulu bweriti lwaki libulako amasannyalaze bwe twavaawo ne tugamba nti omulwadde gwe batugaa nti mutwale embaale oba dokita enkyajja kujja kikeerezi mutwale ne tugamba nti kati omulwadde ono embeera gy'alimu nga mbi nnyo ayinza otufiirako mu kkubo dokita yandibadde amukwatako ne tumanya kyembeera oba mu mmotoka so ate ogenda okwekanga ng'emmotoka nayo batugaa nti ambulensi temuli mafuta mulina okusooka okugenda okola ki okunoonya se muteekemu amafuta kwegana genda okulaba ng'ekintu ekyo okubulamu bw'abantu abali mu Tororo kyabulabe ennyo kati juzi baali badiddeko abasawo abava mu ddwaliro wano mu Lugongo Barracks
ne baleetako omuntu abadde akuula amanyi naye nga musajja oyo nga n'ogendayo omusirikale tasobola kusaba sente nti mpa sente yakkuula n'amala n'akugamba nti genda okujjako nga gw'osanyuse n'ogaa nti omusajja engeri gyankuddemu kamuweeyo kakyaya kakati ogenda okulaba abantu abasinga obungi badduse mu main hospital baddukidde mu Lubongo Barracks era obuyambi mu Lubongo Barracks otuukayo ddagala bali kuwa mu bujjuvu bwereere tebakusaba ssente abasirikale bakudabiriza ng'omulwadde oyinza n'okusaba omusirikale ng'atudde awo naga nti no jangu otuule wano wentudde naye kankuwe service ekola ki emala.
You know, we need to decongest this hospital, and decongesting will not mean that we chase patients. One, a good customer care to a patient. You know, some patients go there not because they are sick, but they think they are sick. Good attention will make them get healed.
Once they becoming a road is you.
Placebo. Then the second thing, we need to strengthen the health center 4s and 3s, so that we maintain the place as a referral hospital.
Yes. You don't get flu and then go there.
Go to another place. The last thing that I wanted to also repeat is strengthening primary health care system. We should not just see signposts. We want people sensitizing the public on simple hygiene.
Yes.
That will prevent them from going to the hospital. It's very bad for us to go there for diarrhea because we can't prevent it.
It's very unfortunate to go to a referral hospital for diarrhea.
Yes. Mosquito nets are being disseminated to the public, but people don't use it. People are using it for fishing, people are using it for tying goats, people are using it. You just just because they don't know its value.
Right.
Now, because we don't have that strong system on the ground, we are having this congested in the hospital.
I like that line of thought. And with the hospital, that services Butaleja, Bududa, Manafa, Sironko, Budaka, Bujiri.
And
what can we
the foreigners.
Yes. Yeah. Because in Kampala it's the same thing. Mulago services many. When you go to northern Uganda, Gulu services many. When you go to Mbarara, these regional referral hospitals service many. But what can we do using the meager resources we have?
If Tororo Hospital has a blood bank, then it should be improved. Because some women die because they are anemic, pregnant mothers.
Yes.
I lost a niece just because they kept on transferring her from main hospital to St. Anthony's. And along the way she died because they thought she would get blood from St. Anthony's. Now I wonder whether Tororo Hospital as a referral hospital has a blood bank.
Even by now, as we talk, there is no blood in Tororo Hospital.
That's very unfortunate.
There is even a notice there showing
there's no blood. So you come when you know it's not blood.
Yes.
I urge all people in Tororo, please go and donate blood. Donate.
If you don't donate, then don't complain that.
Donate blood. That is not even something that, because one day you'll need it, and
and it's given free.
And it's given
free of charge.
Free of charge.
Yes.
Yeah.